I'll tell you. All righty, well, we are going to go ahead and begin. And I am seeing some folks starting to come in. But again, welcome to the UNC Center for the Business of Health's wonderful vertical panel, Career Networks, tonight on a wonderful Tuesday night. And tonight, hopefully you're here to hear about digital health technology and health innovation. We are fortunate to have 4 panelists here tonight from a variety of not only, companies, but roles and also backgrounds. So we are glad to have them here tonight as well. And I also wanted to just shout out to Humana and Acadia Health, who are 2 of our visionary sponsors, who we appreciate supporting not just Career Networks, but the Center for the Business of Health and Healthcare on Campus for everyone. So tonight I'm going to go ahead and let the panelists introduce themselves, and I'm going to start with Chi.
Hey everyone, nice to meet you. My name is Chihao Troy. Most people just call me Chi throughout the UNC ecosystem, but I'm an engagement manager with the Chartis group. I am a 2020 UNC KFBS grad, so very happy to be here tonight. My background, I'm a clinician by trade, so an orthopedic PA, still on staff at a variety of different locations, including UNC Ortho. So if you ever have any injuries, sometimes you can catch me at the Ortho Now clinic when I'm not doing my consulting work. But as a clinician, I worked for many years in clinical practice, tried and true, long hours, saw a lot of patients, and had the opportunity to work with a really great mentor, a guy by the name of Ken Montgomery, who's the team doctor for the Jets. Just very forward-looking, very innovative. And as his PA, I got to work on a lot of those projects as his primary project manager. And I recognized that that was something that I really enjoyed doing. And ultimately, that took me on a journey to business school. So in 2018, I left clinical practice and started at UNC. Really took in a lot of the great resources that are available at the school. Happy to talk about that. Interacted with even some people on this panel. Tried the startup and innovation side of things, pursued some things in consulting, and then ultimately was lucky enough to find Chartis, which is a healthcare consulting firm, where I've been since 2020. So I've been working there as a full-time consultant since 2023. So happy to talk through innovation and what that looks like from a consulting standpoint. Very nice to meet everyone.
Great, thank you. Tom.
Hey everyone, I'm Tom Kaplan, graduated from the full-time program in 2021. Currently part of the Rapid Data Labs at Bristol Myers Squibb. Basically, we deliver short-term analytics solutions to different business units in the company. So we do everything from web application creation to creating dashboards. To more recently, I've been focusing on generative AI solutions, which we're still largely figuring out. I joined this role about 4 months ago after completing the rotational program, which was a 2-year program with 3 8-month rotations. Largely focused my rotations on data science. We're actually recruiting for those roles, so I can share the links in the chat. But so I joined the program after doing the full-time MBA at UNC, focused on healthcare and analytics. Was also involved in the startup community a bit. Tried to launch a startup unsuccessfully. Also worked with Chi on his startup for a little bit. And basically, I joined UNC wanting to work in healthcare technology. Had worked as an RN in behavioral health and had worked on some technology implementation projects, and just found those more interesting and enjoyable than clinical work. So before I worked in behavioral health, I was a professional poker player. Actually played in the World Series of Poker this past summer, which was a lot of fun. But yeah, I'm on my third career change now. I've been really interested in the AI space. It's moving fast. I saw there were some questions relating to AI, so I'd be happy to chime in on those as well.
Great, thank you. Michelle. I think we may have lost Michelle again. So what I'm going to do is I'm going to go ahead and move to Alex, and then we'll catch up with Michelle.
Sounds good. Hi, everyone. I'm Alex Hart. I currently work as an innovation consulting manager at Highmark Health. We are based out of Pittsburgh and are a payer-provider health system, which is the reason I joined there after probably 6 or 7 years in consulting. First at Slalom Consulting, where I was doing large-scale just technology implementations, so a lot of IT project management and delivery work for a health insurer in Chicago. I did that for like 2 years and realized I wanted to move kind of further upstream and be more working with clients to help them figure out which types of projects they should be delivering and strategic initiatives focused on digital they should be focused on and working on. So I moved to a small boutique consulting company in Chicago. They did a lot of custom product development, data platforms and analytics, automation, things like that, mainly geared in the healthcare space. So I did that for a few years and then realized I wanted to kind of go into the payer provider world and work directly for integrated health system. So that's where I am now. I came in as an innovation manager, sadly, with some of the, just market trends this past year. Our innovation team was disbanded, as often happens, unfortunately, when there are, admin and cost cuts. So now I'm sort of still keeping that innovation mindset, but focus more on internal consulting within Highmark Health. And I'm also, as part of that role, which I'm happy to speak to, I sort of finagled my way into sort of moonlighting as the chief of staff for our chief digital officer of our our provider system. So I'm working on his digital strategy right now. And that's me.
Terrific. And it looks like we've lost Michelle for the time being, but when she comes back, I'll make sure we segue her in and get her introduction as well. But I'm going to go ahead and just start with our moderator questions. Again, you all did a really good job, I think, already of kind of like defining your current role. But tell us a little bit about what steps you took to land in your current career. Again, that could be educational, that could be past experiences, but what were some of those steps that we could share with the audience? And free form, anybody answer?
I think I can kick us off, Suzanne. I think for a lot of you, I think you guys have already taken a lot of steps, wherever you are in your educational journey. I think probably that's the same path that probably Tom and Alex and I took, so getting, into the right place to be able to pivot or further your professional career. I think once you're in the academic setting, I think it's really just a great ecosystem to continue to learn and explore and play and find out what really interests you. I think for those people that were interested in healthcare, I think just reflecting on my past experience, I think just having conversations, being part of these types of focus groups as companies are starting to come onto campus, really just learning a little bit more about what those companies offer to you. And I think that one of the things that I don't necessarily recognize as a student, but now reflecting back recognizes more and more important, is that the company, it's a bilateral relationship, and the companies need you just as much as you need them. So it's truly on you to really understand kind of the type of work that they do. I think that when I first started the recruiting journey, I was always very nervous to talk to people. I wanted to always know what they wanted to, but I think what those companies offered. But I think if you have a perspective, hey, this is something that I would like to do in healthcare, this is something that I'd like to do in innovation, it really helps to frame the conversation so that you learn how that company fits into your journey as opposed to the other way around, which the companies will obviously do a good job of in terms of vetting out kind of who they think is a good fit. But I think that as a student, finding that path and being able to have those conversations so that you're informed and can make the best decision, I think is what I would offer up, Susanne, as some of the things that you can do to be able to get into the right place.
I'll add. Oh, or Tom, you can go.
Oh, no, go ahead.
I'll just quickly add, I think also paying attention throughout your career journey of what really like motivates you and excites you is important. And then also on the flip side of that, like where some of your gaps are and where your blind spots are. And that's a great way to kind of think about which classes you choose to during your MBA. I knew I was really excited about digital strategy and innovation and healthcare and how you can help a traditional, like very traditional industry and company change the way they operate and how they make money. But on the flip side, I knew that I had sort of a lack of experience in finance and, financial operations and things like that. And so when I was choosing classes for my MBA, which I just finished this past spring, I was very focused on finance classes and anything that would help me like really get reps and more experience in finance that would help me better connect the dots to some digital strategies and what desired outcomes might be and what impacts that would have on the bottom line.
Yeah, I would add, it's probably kind of similar advice to Alex, is to really understand what it is that you want to make of your career and then go for it. When I came into business school, I know when you write your essay, you kind of have to have a clear path for what you want to do, but I was very much uncertain. And I kind of figured out that I wanted to be in the analytics space. I was, most excited by artificial intelligence. And so I looked for roles that I would be able to do that. And I'll say it was a bit challenging for me. There weren't that many roles that like exactly fit. But was able to find this opportunity and then kind of pivot into it, into the exact role that I wanted after a year or so. Did my camera go out, or it's still okay?
Yep, you're frozen, but we hear you just fine. So
got it. Okay, not sure why that happened.
You would think for the digital technology panel that the technology would work better for us tonight just because of the good ambiance here. So apologies for any of the technical issues going on tonight. And Michelle, I am going to wrap you back into the conversation because already the panelists have told us a bit about their role. And also we're just telling us a little bit about what it took for them to land in their current career. That was just a little additional, like either from their education and or from their past experiences. So again, too, if you want to introduce yourself, tell a little bit about your role, and you can add a little bit about how you got where you are now.
Sure. Yeah, I was laughing at myself with the technology issues I'm having in a technology role. My computer keeps crashing on me, so hopefully that doesn't happen again. Anyways, I'm Michelle Voorhies. I am a Senior Director of Product Management for the Mayo Clinic Center for Digital Health. And my team and I are responsible for mayoclinic.org and all of our other public-facing websites. So we do the kind of experience design and the strategy and partner with our technology team in order to kind of implement all of those experiences. My background is in digital strategy and digital product management, but I'm new to healthcare. So I've been in a number of industries, retail, financial services, hospitality, really all kind of in a similar area of focus from a strategy perspective, but all different industries. I have about 20 years of experience doing that and an undergraduate degree in marketing from the University of Florida. And I live in Chapel Hill, so I like being close to the university just because I live here. So I think the question was, how did you get into the role that you're in currently? I think over the years, I have continued to kind of progress through digital strategy roles and digital product management roles. Really with an eye towards getting into industries that I have passion about. So really excited to have kind of made my way into the healthcare space and able to kind of apply the skill sets that picked up over the years in a variety of different industries. And it's kind of amazing how much similarity there is between things like, selling lipstick or running a hotel on a website as there is with our healthcare space. But yeah, I'm super grateful to be in this industry because it certainly makes it easier to get out of bed in the morning. A lot of motivation behind the mission that we serve. So
terrific. Thank you so much. And you caught up beautifully. So I think that this is great. And I see Tom is back, so maybe we're going to be on an even roll here. Again, those were fantastic bits of advice, I feel. So as students and or folks that are transitioning in their careers are looking kind of towards just kind of like how to look at their next position and how to gain those skills and experiences. I think since we've kind of talked a lot so far, I'm just going to turn it over to the audience to ask a couple of questions before we dive into some more of the moderator questions. So again, just raise your digital hand, unmute, and ask away. All right, Dahlia.
Yeah, thank you all for being here and taking time out of your Tuesday evening for this. So I have a question that I think is relevant for all of you all. I want to ask, what is top of mind in your digital health provider roles respectively? What are your current priorities for future strategy or anything that you're doing in your current roles?
I can go ahead if that works for you guys. I'm like, is there an order? So I'd say, for us at the Mayo Clinic, the patient is at the center of everything. So we, are trying to make sure that we're providing the best experience for our patients. So that drives all of the priorities. But definitely have an acknowledgement that the provider is really the kind of who's providing that experience for the patient. So we put them at the center of everything we're doing as well. So top of mind for us is how do we apply thoughts around how we reduce cognitive burden in our physician staff and use that to kind of drive our priorities throughout the board.
I'll add on to that one of the things that we are working on is pulling together as much as we can across the payer and provider. So each organization has their own set of data and their own set of challenges to solve and things like that. But there are some similarities and shared priorities. And there's a lot of work, especially within digital, that we can do together to make the experience of someone who might be a member of a health insurance plan and also go to that health insurance plan's hospitals really, really incredible. If we can know who you are when you walk through the door, if we can get you 24/7 care, all of that stuff to make your healthcare journey a lot more seamless and integrated, so that you're not having to do a lot of the work on the back end to like make sure that one provider talks to another, or that specialist makes sure that, you know, your claims get billed appropriately and all that stuff that can be a huge burden on the patient or their caregivers. So I would say that sort of frames up a lot of the priorities that we have currently.
I think I'll piggyback off of both of those comments. I think both great points on the front end and the back end. You know, it sounds like Michelle has a very front-facing role in her position at the Mayo Clinic, and Alex talked a lot about the operational kind of background. I think through my lens as a consultant, we work with a lot of provider organizations, and I think one of the themes that comes across is like care model design. I think a lot of you, as you guys are in your classes, I think patient access continues to be a struggle in the US despite all the innovation. And one of the quotes I always like to use is that when you think about healthcare, the fundamental unit is the patient and provider unit. And so being able to empower all the different processes that need to happen around that in order to enable that is like super important. And so when I think of all the different innovation, it really boils down to how can we streamline access? How can we get patients the care that they need? But I think there's so many unique ways to do that, right? Like I think hospital at home is a kind of a buzzwordy type of thing that people like to talk about, changing the site of service. What is some of the things that we can do from a care model design standpoint that sounds very exciting and new and innovative? But I think even for that process to happen, it requires a lot of interfacing with a payer or, you know, other providers, you know, in terms of being able to provide medical equipment or medications at the patient's home that don't happen seamlessly. So a lot of that operational innovation that doesn't sound as exciting, but is absolutely necessary to enable the care model innovation. So I think it's just the two different lenses that we're at a very interesting inflection point. And I think there's right now a lot of opportunity to do innovation in many different areas, both operationally and front facing.
Do you have anything to add, Tom?
I apologize. I was facing technical difficulties. I had to rejoin. I missed. What's the question?
So the question was about where do you see what would be the future of what you are doing in your organization and in your role? I boiled that down. Sorry, Dahlia.
So as I was saying, I'm working on generative AI solutions, which is in practice, it's usually some form of information retrieval from our private documents. So to either be some form of like question answering or summarization. And right now, I think generative AI it's a big opportunity to improve efficiency in the organization. And we're currently looking at, you know, all the different ways that we can use generative AI solutions to improve speed and reduce costs. The space is moving quickly, and we're constantly evaluating new use cases. So I think there's going to be more that comes in the upcoming months and years.
Terrific. Thank you. Again, too, it's great to hear and interesting to hear everything that's going, you know, where you're seeing things go, because this is a very dynamic, obviously, industry to be in. So thank you so much. Sonam's got a question. Go ahead.
Hi, everyone. I second Dahlia. Thank you so much for taking out your time this evening. I'm currently a medical student, I'm MD MBA. So you already touched on my question. I was going to ask about how like digital health and innovation is helping like underserved populations. I was curious about the role that we're kind of investigating in that arena for the future of health. And since you guys talked about it a little bit, my second question is increasing clinician buy-in when we have these ideas. So for hospital at home, for example, right as I was finishing up clinicals before I transitioned into the MBA, a lot of attendings were unaware, even though we added like a column on Epic. And so as we kind of think about like leadership in hospitals, how do we increase buy-in with these ideas as they come about? Thank you.
I'm happy to provide a point of view around what we're seeing in my role. Can you guys still hear me? I had to transition to my phone. Okay. All sorts of technical difficulties. So, I'd say the thing that the method that we choose to leverage in order to increase clinician buy-in really is strong partnership from the beginning. So as administrators, we all have dyad partners, and in some cases, triad partners with representation from key clinical partners, both in the nursing and physician side of the house. So we really engage them very early on in any of the ideas and any of the innovation that we're putting into practice. Leveraging their point of view as well as their network in order to make sure that we're creating the right product that's going to solve challenges that folks that are on the front line of providing care are seeing on a day-to-day basis. And we find that bringing folks into the conversation super early helps create those proponents to go out into the organization and build the awareness and kind of evangelize the new technologies that we have in place. We often get a lot of feedback that, like you said, you added a tab to Epic. Well, they don't want to click on another tab in Epic. And how do we make sure that experience is really kind of seamless and integrated? And the only way we're going to be able to do that well is if we have the clinical voice early on in the creation process, because I don't know how that experience is, but if they're willing to provide it, it really helps us be successful in our rollouts.
Do you mind if I ask a follow-up question to that real quick? Is it, when you say early on, is it through focus groups, or is it electing someone onto a committee, or what does that look like from the beginning?
Yeah. So we do both. We have at a certain level in the organization, we have an assigned clinical partner. So that person is basically with us, forever. Well, not forever, it's rotational, but they're there early in the kind of strategic conversations and roadmap conversations. But we also lean on our user research team in order to collect input from internal facing customers as well as external facing customers. And often that's a clinical audience if we're looking for kind of input on something really granular, whether it be, an actual experience that they're going to put their hands on at point of care and those kinds of things. So we leverage both.
Awesome. Thank you.
All right. Anything to add?
I'll add quickly. I think another thing that we're trying to do, and that's sort of on our roadmap, is making sure that any of the we do a lot of patient solutions. So say you're a diabetes patient, we have an app that you can kind of help track your health and manage that ongoing, et cetera, when you're not in the doctor's office. But that's not relevant for a patient who doesn't have diabetes. So in Epic, if there's a pop-up for a provider who's talking to a patient who doesn't have diabetes, but they get this solution, hey, talk to the patient about this, it's really not relevant. So I think too, making sure that what you're providing to the patient or to the providers or asking them to do is relevant to them, their specialty, and their patients as well. So just making sure you're engaging them in the right way and using the right data to do so.
So no, I have one more thing to add too. I think I can definitely relate as a clinician. I think one of the things, every time I show up in the clinic every 3 months, there's a new application or new button I'm supposed to click that I have zero awareness about. And I think a lot of what, in our experience, we've helped a lot of organizations implement new solutions. I think, of course, what Michelle had mentioned, setting up a partnership structure that allows for physician feedback, I think really design thinking, having some of these design thinking sessions where they can really talk about the problems that they're facing and really work together in a collaborative manner to develop solutions, I think is a good starting point. But one of the areas that I think can be very helpful just starts with communication, right? When you think about your communications classes, like effective communication, hey, what are the goals that we're trying to hit? This isn't necessarily a clinical goal, but from an operational standpoint, this is something that our organization is really focused on. We would appreciate physician participation in helping us achieve that. Sometimes just having that knowledge can be very effective. And so crafting effective communication, making sure that you're using those change agents to say, hey, listen, there's a reason, there's a case for change, these are the things. And I think physicians are highly intelligent people, but they're not always informed. And sometimes those things fly by, they don't get the memo. And so I think that's something that we always look at. Can we be better change management, change managers? What can we do from a communication standpoint that I think can be very simplistic, but often overlooked.
Terrific. Thank you. Rebecca.
Yes, can you hear me? Yeah, thank you. Thank you all for being here. So my question is, what kind of impact do you think technology and digital have on healthcare equity? I'm particularly interested in a senior patient because during the pandemic, we have like virtual appointments with patients, but most the people that are using them are most used. So what I'm curious is about, do you think it's the gap is became bigger or it's shrinking?
That's a really interesting question. And again, too, my first thought was, since this is a panel of folks that use digital platforms that look toward digital improvement, I guess what is the reach that you have for folks that might be, again, too, elderly, that might not have the skills to use these digital elements, or they might be people that don't have connection in rural areas. Is that part of what maybe your industry kind of thinks about, or your organization, and how to bridge that gap?
Yeah. That's what I want to know, just how to bridge that gap for like senior patient. Yeah.
I mean, I can acknowledge that we recognize the gap, but we don't have like a magic answer just yet. How do you kind of, make that more accessible? And we observe the same thing that you described, that, a younger patient or a more affluent patient is more willing and able in order to take advantage of, some of the more advanced technologies that we have. And populations that maybe have less access almost require kind of like a Sherpa, like somebody to just guide them through it. And, we've explored some types of things like, how do we, act as your guide? How do we get involved, get on the phone with you in order to kind of walk you through the setup of some of the devices and those kinds of things? But I would say it's definitely an opportunity that we need to focus on and try to figure out how to do better.
I can give an example of one that it's not specific to access. I think like what Michelle is talking about, it's more about measuring the impact of certain interventions for older populations. So a project I worked on a couple of years ago was a partnership between a long-term care facility, like an innovation hub or something, like an innovation challenge, and I think a health insurer as well. And what they did was, the innovation challenge was basically, how do we reduce loneliness in older populations, which is a huge issue and has impacts on health. And they came up with a really low tech solution. Like they just essentially sent out like a blank newsletter to that patient's family, the patient in the long-term care facility, and said like, hey, pop in some information about what's going on in your family's life, like what the grandkids are doing, etc. And then that was sent to the long-term care facility, they printed it out and they gave it to the patient in the facility. And while they were doing this, I think they were doing it weekly or something. While they were doing it, they were measuring, and the physicians in the room might actually know what this is called, but I guess there's like a clinical loneliness score, where you can like fill out a survey at regular intervals, basically ranking how lonely you are. And so the long-term care facility, as they were giving out these newsletters as a clinical intervention, more or less, was also measuring how lonely that patient was week to week and if it was improving with this intervention. And then the reason for having all of those different entities across the healthcare ecosystem together was so that they could measure the impact of that intervention. So on the clinical side, was it actually making the patient healthier? Were they, attending social events or doing whatever it might be? And then were they feeling better? Were they like, I'm not a physician, so I'm not going to use the clinical words. And then on the payer side, it's like, were their cost of claims going down? And overall total cost of care. Obviously, this is over like a long time frame. But I think that's an example of how data and having that information is really, really powerful. I don't think it specifically speaks to like health equity, like what you're talking about, but I think that's an example that can be sort of leveraged in other places as well. Like it doesn't have to be a digital solution that someone uses. It can be super, super low tech, but if you have the data to measure how well it's working, that can be really powerful in and of itself.
Perfect. Thank you. And Rui.
Hi, Susanne. Hi, everybody. Thank you so much for the panel. Very, very insightful things being discussed in digital health. So I'm a physician at UNC. I'm a preventive medicine resident, and I do use Epic, and I just wanted to ask questions about interoperability. So one of the biggest problems I think we have with electronic health records is they can't really talk to each other, really. They can't really sort of share that information. And I think data becomes siloed in between different organizations. So what strategies do you think we need to sort of implement in the future for digital health to address that? And then I have a follow-up question, but yeah, I just thought I'd just throw that one out there first.
I think if the interoperability issue could be solved by someone, they would be the first trillionaire, because it's a huge problem. I mean, I think just solutions that make it easier to incorporate different data sources and a multitude of data sources is a start, but I mean, people have different incentives. They're not incentivized to share their data, so I don't know what the answer is. I mean, I thought about it a little bit, and might need some kind of government intervention. But yeah, I'm not sure the private market is going to be able to solve it.
Yeah, because I think just from a pain point as a physician, I'm always trawling data from different healthcare records, and I can't get the full picture. So I do think if there is some sort of government policy being placed for allowing data share within a controlled environment, that might be the future. I was just curious if anyone else had any thoughts on that. The second question I had, specifically with, say, something like Epic, is I feel like there's so many tools and it's very overwhelming for the user to understand how to use new tools. Do you think the vision now for these electronic health systems is to sort of streamline these tools to make it user experience, to make it user friendly for the providers? Or do you just think everyone has their own sort of agenda of adding a new tool just to add it? Because I think that's also part of the problem that's driving clinician burnout, is using EHRs, and it's actually having a huge impact on the workforce.
If you don't mind going back to your first question, I wanted to share a thought, and then I can talk about the second one too, but I think you guys were talking about the interconnectivity between the data and how do we get ourselves to a place where it's together, both from like a clinical access perspective, but also from like creating the underlying data structures and platforms to kind of push forward healthcare in general. I just wanted to acknowledge that Mayo Clinic is trying. You all can go out and look at the Mayo Clinic platform. It's a public facing part of our organization that is investing really heavily in attempting to kind of connect the dots between the underlying data structures and kind of create those de-identified environments so that we can connect the data and also try to connect the forward-facing electronic health record as well. So I don't know if we'll be successful, but we're giving it a whirl. We're trying it out to try to make some progress there. I'll let somebody else chat about your second question.
Maria,
I can share some insights on the first question. There is FHIR interoperability standards available for payer and healthcare systems. It's not widely used, but there is still some adoption curve for certain data sharing between those platforms to Epic and EHR data from the insurance claims point of view. I'm calling from the Blue Cross Blue Shield North Carolina insurance side of the fence. We introduced those APIs and enabled it, and we do have some data flowing close to real time between these systems. Look up for FHIR for healthcare. Thank you.
Rui, I would just add, yeah, there's definitely like the FHIR protocol. I think there's attempts. I think one of the questions that I've always thought of it, Tom's answer was, I think, very honest, but I think very realistic. I think government interaction, I think one of the issues that I think we've learned over time is that right now there's a battle going on in terms of who owns the data. Is it patient data? Is it Mayo's data? Like, who owns it? And so there's, a significant amount of privacy laws, that's kind of the backstory in the ecosystem. I think in a lot of, the models that we see, distributed models, like think of like Uber, right? Or like a Venmo, where you don't have to have a centralized resource. I think that is ripe for innovation, where, hey, in order for me to have a transaction, I don't actually need to go through this UNC entity. I'm just going to have it between that fundamental unit, between the patient and the provider, right? Like I'm a clinician. I can do 50% of my work with a patient outside of the confines of UNC. I could lease space from UNC. I could do a lot of things. Like, I have to pay 40% overhead of my salary to UNC. Is that model still effective for me? And so I think what you'll see is a lot of innovation in kind of that direct kind of distributed model. I think the second case, and I'd love the panelists to push back here. This is just me being a negative clinician. I think one of the things is, as a clinician, I always struggled that I said, I've had sound bites where like, hey, I've been in healthcare. There's been $1 billion of healthcare innovation and investment during my career as a clinician, and I haven't seen any of that. I can't think of one solution that has made it easier for me to see patients. I was there when I started practice. I had paper charts, and I was there when we first adopted the EHR. And no one's arguing against the benefit of the EHR. It's a very necessary and important part of the U.S. healthcare system. But I think when you think of who Epic's customer is, it's not individual physicians, it's healthcare systems, right? That's who they're going to sell to the healthcare system. They're not necessarily selling to you. So I think in that manner, it's hard, when you're looking for a solution that may make your workflow easier. That has to be something that's readily adopted by all of the different end users of the organization. And I think one of the things that we can do as clinicians is champion that voice. If there's something that doesn't smell right, or, hey, there's a process, that's something that should be communicated up so that as an organization, they say, hey, this is a feature we need. This is something we need to build out as a specific use case for our health system. Because I think that's at the end of the day, I think that's just the reality of it. Right? Epic doesn't work for you, they work for UNC.
Great, and thank you, panel. And again, too, what Tom said about the incentivization, like, I think that is a second key there. So, but it's so complex. but I think you all added some really interesting pieces and also provided some platforms that are trying this. So this should be an interesting thing to watch over the years. All right, I'm going to pass it to Dahlia again.
Thanks, Suzanne. Yeah, so my question's actually maybe geared more towards Chi and Tom, with your kind of direct startup experience, but open to all. So what did you see that didn't work in the startup space that challenges you to work or think differently in your work today?
I could start. I guess the main issue that I encountered in the startup that I was doing was getting product market fit and making sure that the product you're offering is giving value to your customers. I think where I missed out was on the beginning was doing more customer discovery up front and doing more interviews with customers and making sure that, you know, the idea that you have, it might sound good when you talk about it, and you know, it might all you know, look like it's a perfect solution, but there's really isn't a way to validate it until you test it with users and make sure that you're solving an actual problem. And so, yeah, if I could go back, I definitely would have invested more upfront time in that customer discovery process.
Yeah, Dahlia, I would echo that sentiment. I think just spending more time thinking about the problem, the solution that you're proposing. There was a really great masterclass with the founder of Spanx. And I think one of the takeaways that I had from her talk was that she said she spent the first year and she didn't tell anyone about her idea. She just needed to noodle on it. She needed to think about it. And I think one of the things that oftentimes as a founder, you know, you're like, hey, do your elevator pitch, go talk to Tim Flood, go, you know, talk to all these people. I think that sometimes can be intimidating, and it takes away from what Tom was speaking about, like that product market fit. Have I really thought through this problem? Have I talked to enough stakeholders? Do I truly understand the problem? I feel like in terms of my execution and playing Monday morning quarterback and thinking about that, I think that was an area where I feel like if I spent more time, and business school is a great incubator for that. I feel like you have a lot of time in business school. I think that that's something that I would have invested more in, rather than thinking of, should I do an LLC or a C Corp? How am I going to split out my shares? You know, which someone can help you out with later on down the road.
Great, thank you. And your answers lead to my next question or pair of questions. And so Dahlia, I was going to say, I didn't mean to keep going. It's just that was right for the taking here. So I heard you say, I wish I had done this while I was in school or had the opportunity. So in your current careers, are there any skills that you use every day that were surprising to you when you came in? And the second half of that question would be, were there things that you now wish you would have taken advantage of during either your undergrad, your graduate experience, or even in you know, your career prior to, you know, what you're doing at the moment?
One skill I use a lot is just like politicking. I work for a huge, I saw Michelle's face there too. I'm sure you deal with it too. It's just, when you work for a huge healthcare company with a lot of people who have been there for a long, long, long time, and you want to come in, especially and do digital, which a lot of times people think is like just an app or just a clinical solution or just a whatever. It requires a lot of like socialization and networking and like being very purposeful about what words you use and don't use. And I think I can't remember which class it was, but there was a class that talked a lot about like your influence networks and who's an influencer and what like level of kind of power they have. That is a very important skill to understand, and then to understand like who cares about what. So the digital strategy I'm working on now for our hospitals has to please everyone, which is really hard to do. So understanding a lot of that, like socialization and networking and relationship building up front is really important. And doing that legwork and understanding who your naysayers might be. And then if they're a naysayer, who else would be a naysayer as well?
Yeah, like 100 times. If I could like give you like 100 high fives, like, and I think, you know, a learning for me, being new to healthcare, I was surprised by how much more intense what Alex just described it is in the healthcare space. You know, so definitely network building, which has been super critical and important through my entire career, because not only are they going to help you with your current, you know, initiatives and efforts and whatnot, that's also how you find your next thing. So, you know, really investing and doubling down there, I think is super important. Just one thing to add on that, which, you know, I totally agree with the softer skill set around figuring out the network and how to kind of tell the story and whatnot. I think the other one that maybe is not something that you probably are all leaning into it because you're getting MBAs, but the ability to support your storyline to that network with insights that are solidly based in data, I think helps to kind of really build your credibility within the kind of conversations that you're having, especially with a clinical audience who's, you know, used to research-based, kind of very heavily data-driven. I think it's super easy to quickly fall into opinions and emotions in a lot of the conversations that we have, but investing in understanding how to look at data and turning it into insights, I think makes you shine and stand out.
I'll say I going into the corporate world, I probably underestimated the amount of politics involved. In our company, you have a lot of there's a lot of different groups who are kind of vying over doing specific type of work. Basically, the more resources that you can show that you need, then kind of the more important your role becomes. So there's a lot of people trying to, different business groups trying to pick up work to show that they need the headcount, and then that leads to, you know, them needing a bigger title. To the second question, what I wish I learned or focused on a little bit more, I think, was the second part to the question. For me, coming into more of I'm in more of a technical role now. I do a lot of work in Python and with different data science tools. I do kind of wish I had dug in a little bit deeper during the MBA. Maybe the learning curve would not have been as steep.
Right. And Chi, any skills you use that kind of surprise you?
Yeah, I feel like I'm giving all these UNC sound bites, but I think UNC is known for its leadership, and I think just leading with integrity, kind of incorporating a lot of what the other panelists had said. You know, I think it sometimes can be challenging in the business world to do what's right versus what's easiest, right? You know, what Michelle was talking about, maybe putting together a data analysis rather than just going with an opinion that you may have heard key stakeholders mention. I think just leading with integrity, I think the people that you work with recognize that. And I think as you think of some of the leadership classes that you take, as you think about some of the clubs or some of your student organizations that you lead, it's a great opportunity to think about kind of the people that are around you that are aligned around the same interests, the same missions, and figuring out a way where you can kind of practice some of those softer skill sets. How can I lead this group of people to kind of accomplish our goals? Do I need to be more front facing and directive? Can I help, you know, promote other people on my team? And just thinking of unique ways where you can lead people.
Terrific. Thank you so much. Those were very insightful answers there. And since we are kind of getting to the end of the session, I'm going to put one more question out to the panel. And this is something that I think is a pretty happy question, is what excites you every day about either walking through the doors of your office or just getting on digitally?
I mean, I can share, I think, you know, just being new to healthcare, I really do get very excited about the opportunity to make a difference in the space that is really, you know, is going to change the world. I feel like we're in a period of time where 10 years from now, 15 years from now, it's just going to look so different. And our, you know, loved ones are going to be able to benefit from the work that we've done within this space, which, I don't know, that gets me out of bed every morning, like I said. So I'm super excited about those opportunities.
I love,
Oh, go ahead.
no, you go first, Tom.
That's okay. I was going to say, working in the AI space now, I'm pretty optimistic about the opportunities that AI will have to change healthcare. I think it might take, you know, longer than people are anticipating now, but I definitely think that the changes are coming. And so I think for me, it's an exciting time to be part of something that's improving the system.
I get really excited by working with folks who aren't, I guess, jaded or burdened by how the system's always been. And I also get motivated and excited to sort of bring those folks over who are really jaded and very hesitant to change. That's something I genuinely enjoy doing, and having a good story as to why they should, and building a relationship with that person to get them to trust that, you know, hey, that maybe this won't be so bad. Or maybe we can do something differently. And I think just seeing like even those incremental changes week over week, or I find that exciting.
Yeah, I think building off of Alex, I think it's exciting time to be in healthcare. I think there's just so much attention, and we have a lot of smart people shifting over from different industries, you know, coming up as business leaders. And I think that, you know, challenging the status quo, I think that's going to be exciting, right? Like channeling my inner Marcus Saba here, for those of you that know Marcus, but you know, counterfactual thinking, we're gonna have to think differently about like the solutions that exist in the healthcare space. And I think there's a lot of smart people that are excited and, you know, working hard across the country to find those solutions, and being part of that, I think, is super exciting.
Terrific. Great answers and exciting answers. And hopefully, though, those answers will motivate our audience to really take a look at healthcare and see the many opportunities and roles available to them. So again, it's we've got barely a minute, so I'm going to help us to sign off. Audience, if you'd like to get in touch with any of our folks, please, first of all, look on our career networks. And if you don't see them, just email me and we will get you connected. But again, I want to thank our panelists for taking the time tonight. Again, this was just very insightful answers. Just a great discussion, and thank you also, audience, for your great questions, because that is what really makes these discussions deep, memorable, and valuable. So again, thanks everybody. Have a good night, and we'll see you next time.
Thanks all. Good night.
Thank you.
Take care.